Good morning. I'm Russell Myers, CEO of Midland Health. This is our coronavirus update for Tuesday, September 29th. We'll start with a few numbers. In the state of Texas, just under 740,000 confirmed cases so far, over 15,500 deaths to date. In Midland County, 3,759 cases and 84 deaths through yesterday. In the hospital, our census is 162 patients today, down a little bit from our peak numbers most recently. Our critical care census is down to only 9. In the COVID cohorts, we have no patients in critical care and 9 in the medical unit, a total of 9. 2 of those have come to us from the jail, and I'll talk to you about that a little bit more in a second. None of them are from the Ashton Medical Lodge. As you may have heard, when the governor addressed the state recently, one of his targets was 15% of hospital census being COVID positive as a red flag, a point at which he would consider increasing restrictions in an individual community. Our 9 patients on 162 census is 5.5%, so well below the 15% concern threshold as articulated by the governor. Moving on, we have a total of 5 patients on ventilators in the hospital. None of those are our COVID population, so plenty of ventilator capacity. Emergency department traffic seems to be slightly increasing. We were at 155 patients yesterday as we begin to get into the fall and winter respiratory disease season. So we would expect that ER volume to continue to go up. And I'll repeat my urging to any of you in the community. If you think you have an emergency condition, if you believe that you need to come to the emergency department, if you want reassurance about that, you can always call 6-8 nurse. But please do not hesitate to come to the ER if you are in emergency need. It is a perfectly safe environment, and it is where you need to be if you have an emergent condition. So please do so. With our workforce, we have a total of 8 employees who have tested positive for COVID-19 and are currently in quarantine status. We have 5 others who are quarantined for different reasons, and a total of 18 employees who've had some level of exposure requiring them to self-monitor, to check in with our employee health group, and to watch their condition in case they should develop and need to be tested again. Some good news, we have, as you know, we've not had volunteers in the hospital for a number of months now, or they've been extremely limited in their activity. This week on Wednesday and Thursday, we're providing some infection control and COVID-specific training to our auxiliary members who want to return. We understand there are a substantial number of them who have an interest in coming back into the hospital. And so once they've been through training and feel safe to come back into the hospital, they will do so with the same kinds of restrictions that our employees have: daily self-monitoring, wearing face coverings, frequent hand hygiene, staying out of group settings, assuring the full range of protective gear is available to them as needed in their work environments. We particularly need them at the front entrance, running the gift shop, crucial places where we've really missed our volunteers in recent months. And we'll be very excited to get them back once they've been trained and can return safely. So that's good news. Returning to the subject of testing for a moment, our test sites have been busier here recently. This week, and last week, we tested almost 600 patients. The percentage of those who were positive was over 11%. This week so far, it's only Monday, but we had a very busy day yesterday. A pretty high percentage of positives came through the testing center. So what we're seeing in general is a slight uptick in the demand for testing and in the percentage of those tests that come back positive. We're going to continue to watch that in the days ahead, but that's That's a change in our trend after several weeks of steadily declining demand and percentages of positive. Also on the testing subject, we're going to remain with our current plans through the end of this week, but effective next Monday, October 5th, we'll be closing the Coleman clinic testing site. We're getting to the point of the year where the weather is a little bit more extreme, windier and cooler, soon to be colder. The Coleman site, unfortunately, doesn't have much weather protection. And so as we ask our teams to work outside to manage drive-through testing, we're not so worried about the patients who tend to stay in their cars, but the staff are affected pretty dramatically by the weather as it changes. So we're going to consolidate, close the Coleman site, consolidate everything back to our original West Campus site, which is considerably better protected from the weather. That's effective this coming Monday. We've been splitting the mornings between Coleman and the West Campus. We'll be going to a full morning, 9 a.m. to 12 noon, all at the West Campus, beginning this coming Monday, October 5th. So keep that in mind should you be referred for testing. This week, both sites are available. Starting Monday, only the one site at the West Campus will be available for patients referred either by 6A nurse or with a physician's order. At the jail, we have, as you've seen in the local media, there's been a fairly significant number of new positive cases uncovered. Only 2 of those patients have been hospitalized so far, and at least one of them did well and has already been discharged. We are in regular communication with the jail to try to help them with the challenges that they face in managing that large population of inmates who are not in an environment that's intended to be a healthcare facility. So they're managing as best they can within their limitations. One bit of good news, we were able to provide a machine and some training and at least 1,000 antigen tests. Those are rapid turnaround test kits, so that the jail can test the inmates as they come and go at their discretion. So they've got the training, the machine, and the tests available to do that. We'll continue to work with them and help them get more if they need them in the days ahead. But the jail certainly is a challenging environment. We're trying to keep close contact with county personnel to be sure we manage that as well as we possibly can together. I think the last of my major points is about visitation. This is a significant change. I think you know that the state had an emergency order severely limiting visitation, and it was in place for several months. As of this past Friday, the Health and Human Services Commission has issued a new emergency rule that removes those basic restrictions, but gives the authority and the responsibility back to individual hospitals to set their own visitation guidelines. So our clinical team has been working for several days to develop a set of new guidelines that are as safe as they can be, while also opening visitation for most of our patients throughout all that we do. That's been an important concern that's been voiced by patients and their family members from the beginning, really, of the pandemic. We had a brief window where we were able to allow more visitation, and it certainly, we believe it helped people to manage the crisis better than they might otherwise. It's hard to be here alone as a patient, especially an inpatient. And so we have adopted now a new visitation policy that will be effective tomorrow. Wednesday, September 30th. And I'll give you a few highlights, and I'll also direct you to our website where this newly revised policy will be posted and available for your detailed review at your discretion. So just a few key points. Number one, we will still, with only very, very limited exceptions, not be allowing COVID patients to have visitors. If you're a positive patient, if you're on a COVID designated unit, you will not be allowed a visitor. That can be changed, that we can make an occasional exception, especially if there's a patient at the end of life. Those decisions are in the hands of the clinical manager on those units. But as a general rule, the COVID patients on the COVID wards will not be allowed a visitor. Patients in critical care, non-COVID patients, will be allowed one support person, one visitor, and we'll be maintaining the hours of 6 a.m. to 8 p.m. In critical care, we'll be asking those visitors to go home, to leave the premises at 8 p.m. every day. Only with very special circumstances would we allow a visitor to stay overnight in the critical care environment. In the medical surgical environments, however, we will allow that one visitor per patient will still be the limit. That one visitor will be allowed to stay overnight if they choose to do so. Patients in the emergency department. This has been a concern, I know, for many people. Every emergency department patient will be allowed one support person during the course of their stay in the emergency department. Should they be admitted, then of course the rules for whatever unit to which they are admitted will apply. Most of our outpatient services are going to allow for one visitor. That's outpatient surgery, especially our imaging environments. But we're concerned that we not congregate in waiting spaces. So for the outpatient surgery patient, for example, those patients are assigned to a day surgery room, which is a private room, so their family can wait in that room. We will not be allowing families to congregate in the surgical waiting room. That surgical waiting room will still be closed, but any other outpatient service where there's a private room, in general, those patients will be able to have a visitor. There are places where that's not possible. The highest volume area is endoscopy. In endoscopy, we have only a small waiting room and the procedure rooms where the patients have their procedures. There is no space for a family member to wait, and so an endoscopy patient will not be allowed a visitor for the foreseeable future. That's also true on a case-by-case basis with our outpatient testing center, where we do EKGs and lab draws and other things. There's no good place for a visitor to wait there, so that patient population, with rare exception, will be asked not to bring a visitor as well. The rules on labor and delivery and in pediatrics are generally the same as they have been. With labor and delivery, one person, or it can be two support persons. One of those can be a doula if the patient so chooses. In pediatrics, both parents or both guardians can be present. One of them can spend the night with the child. Those are not much different from what we've seen before. The points of entry to the hospital remain the same for patients. The emergency department, 24 hours a day, but during the hours of 5 a.m. to 5 p.m., we'd like people to avoid the emergency department entrance unless they're coming to the emergency department. If you're coming for any other purpose besides an emergency visit, we want you to come to our main entrance, still on the north side of the hospital, into the Scarborough Tower lobby, 5 a.m. to 5 p.m. All visitors at both those sites and all patients will be screened. If you have symptoms of COVID-19 infection, you will be asked not to come in. And that's really not different from where we've been. We are allowing more of our entrances to be open for badge access for employees and physicians to make things a little bit easier for them to get to their workplaces. As I said before, we will not allow congregating in waiting rooms or in lobbies or any other place where people have traditionally waited in groups. That's just not going to be a part of our reality for an extended period of time. No children will be allowed to visit. If you're under 18, you are not allowed to be a visitor in the hospital, again, with very rare exceptions at the end of life based on the judgment of the clinical manager. Of course, if you're under 18 and you're a patient, you're welcome. If you're an emancipated minor, perhaps a labor and delivery patient, certainly you are welcome to be here, but otherwise under 18 will not be allowed as visitors. And then finally, visitors can bring food or other personal items with them if they're visiting a patient. We've had the suspension of deliveries for a lengthy period of time because we didn't want delivery personnel moving through the hospital. We are going to allow food and other deliveries to resume. Those are challenging to manage. We're going to have to figure out how. We're not going to allow a delivery person to go past the front desk, past the screening point. So as the volunteers come back, we'll have more delivery capability, and of course, individual family members can bring what they choose to bring. Finally, the last thing to say about visitation is all of these changes can be revoked, can be revised at any time. We're going to be very carefully and very thoughtfully reviewing the impact on the facility of adding additional visitors. We're going to be watching our hospitalization rates, watching the community's infection levels. If we begin to see another spike, we will certainly revisit, and we may have to restrict visitation once again. But I think, to the state's credit, they have put the authority and responsibility for managing visitation back on the individual hospitals, recognizing that each of our situations is a little different, and we intend to take those responsibilities seriously in the days ahead. So I believe that is the last of my prepared remarks. That was a lot for today, and I'll be very happy to take questions.
We have a question, excuse me, sorry. We have a question from Facebook. Can you clarify the claim that hospitals are receiving money from the government, resulting in people just having a diagnosis of COVID?
Clarify the claim. Okay, I'll answer what I think you're asking.
Okay,
How about that? The Medicare program, almost from the beginning of the pandemic, Medicare has placed a 20% add-on to the typical Medicare patient for an inpatient with a COVID diagnosis. There's a group of diagnoses for which that 20% add-on is appropriate. If they're coded properly, then the Medicare program does pay the hospital 20% more. No other payer does that. And even with that 20%, we've analyzed 2 or 3 times during the course of the pandemic, and we've found that we still lose money on virtually every COVID patient, even with the Medicare 20% add-on. The costs are much higher. And so while it is true that there is some additional money from Medicare, that doesn't yield profitability for the hospital, but it does help to cover some of those extra costs. Of course, then we also have the CARES Act funding that is separate from direct patient care. It came to us from the federal government with the intention of replacing lost revenue. We've had massive amounts of lost revenue through this crisis, and also helping us to pay for the cost of testing and for all the massive amounts of personal protective equipment we've used that's very costly now. So there are sources of funding that have come to us primarily from the federal government, which are much appreciated. But in our case, and in the case of most hospitals that I'm aware of, it mitigates the losses. It makes it less damaging to us than it would have been otherwise, but it hasn't put us back to where we were performing before COVID. We do not expect to make our budget for this year, but it has helped us to survive the pandemic, which has really been very helpful.
Thank you. We have a question from Stuart Doreen with the MRT. He says, I apologize, I came in late. Can you repeat the number of tests last week and the percentage of people testing positive?
I can, Stuart. I think it was 599 tests last week, which was up considerably from the prior week. And last week's percentage positive was 11.4%. So it was 9.5% the week before, for example. So we have seen a little uptick. We've also seen an increase in the demand for testing.
Thank you. We have a question from Facebook. If we take a flu shot now, is there a booster shot to take later since they are only effective for a short period of time?
Well, it's not accurate that they're only effective for a short period of time to begin with. We expect the flu shot to last for the full season. So we are encouraging people. We've encouraged our workforce. I got my shot last week. Most of us did. We're continuing to vaccinate our workforce. We've begun the protocol for vaccinating patients. Do not wait. Do it now. You don't want to wait a few weeks and in the meantime get the flu. I can promise you that's a miserable experience. And in these days where COVID remains in the community, a combination of flu and COVID would be particularly devastating. Don't wait. Your flu shot should last for the full season.
Thank you. We have another question from Facebook. Any comments on the county releasing positive COVID inmates from the county jail into the community and untested people from the jail being released?
Well, I'm not aware of what the county is doing with regard to jail release. So I don't know if those concerns are accurate, and I really don't have a comment on either one. Thank you.
Thank you. It appears that's all the questions we have for today.
Okay, I appreciate your attention today. That was a lot of information. Perhaps the most important takeaway today is the significant change in our visitation policies effective tomorrow. I would encourage you to go to our website and look at our visitation policy. It's very straightforward. Depending on what your reason for being at the hospital will be, you can easily tell whether a visitor will be allowed or will not. And that's all changing effective tomorrow morning. The other significant change is effective this coming Monday. The Coleman Clinic testing site will be closing. So it'll be open through this Friday, and then Monday, October 5th, we will consolidate to a single drive-through testing site at our West Campus, 9 a.m. to 12 noon each weekday morning, beginning October 5th, this coming Monday.